Internal surface of cranial base, posterior cranial fossa, largest and deepest, lodges, cerebellum, pons, and the medulla oblongata, formed mostly by the occipital bone, internal acoustic meatus, facial nerve, vestibulocochlear nerve, CNVII, labyrinthine artery, hypoglossal canal, anterolateral margin of the foramen magnum, hypoglossal nerve, CNXII, hyoid bone, single U-shaped unique component of the axial skeleton, has body and paired projections, lesser and greater horns, no articulation with any other bone, located in the anterior neck between the mandible and the larynx, suspended from styloid processes by ligaments and muscles, supports the tongue, attachment for tongue and pharynx muscles, helps to keep the larynx open, consists of muscles and ligaments attached to these paired projections. The vertebral column, with the sternum and the ribs, trunk of the body, comprises 26 vertebrae, adult, 33 vertebrae, prior to fusion of sacral and coccygeal, about 71 cm adult male and 61 cm adult female. 7 cervical vertebrae, neck region, 12 thoracic vertebrae, posterior to thoracic cavity. 5 lumbar vertebrae, supporting the lower back. 1 sacrum, 5 fused sacral vertebrae, 1 coccyx, 4 fused coccygeal vertebrae. The cervical, thoracic, and lumbar are movable function, encloses and protect spinal cord, supports the head, serves as a point of attachment for the ribs and the muscles of the neck, of the back. Normal curves of the vertebral column shows 4 slight bends. Normal curves viewed from side, convex. Cervical and lumbar curves are secondary curves. Concave thoracic and sacral curves are primary curves. Fetus, single anteriorly concave curve. 3 months cervical curve. When the child sits, stands, and walks, lumbar curve. All curves fully developed at 10. Functions: increase its strength and protect the vertebrae from fracture. Help maintain balance in the upright position. Absorb shocks during walking. Intervertebral discs found between the bodies of adjacent vertebrae. Second cervical vertebrae to sacrum. Each disc has an outer fibrous ring consisting of fibrocartilage, annulus fibrosus, an inner soft, highly elastic nucleus pulposus. It forms strong joints which permit various movements and absorb vertical shock. Parts of a typical vertebra vary in size, shape, and detail. Typically consist body vertebral arc and several processes. The body, weight-bearing part, thick disc-shaped anterior portion. Its superior and inferior surfaces are roughened for IV or IV disc attachment. Nutrient foramina anterior and lateral surface. Vertebral arc extends posteriorly from body formed by pedicles. The pedicles, two short, thick processes, project posteriorly from body. Unite to form the vertebral arc. Exhibit superior and inferior indentation called vertebral notches, which are stacked on top of one another and form an opening between adjoining vertebrae or intervertebral foramen. The body and the vertebral arc forms vertebral foramen. Vertebral foramina of all vertebrae form the vertebral or spinal canal. Processes. 7 processes from vertebral arc. Transverse process extends laterally on each side from where the lamina and the pedicle join. Spinous processes single and protects posteriorly from the junction of lamina. Are points of attachment for muscles. 4 processes form joints with the other vertebrae above or below. The articulating surfaces or facets are covered with hyaline cartilage. 5 regions of the vertebral column. 1. Cervical region, C1 up to C7. 2. Thoracic region, T1 up to T12. 3. Lumbar region, L1 to L5. 4. The sacrum. 5. Coccyx. 1. Cervical region. Smaller bodies than other vertebrae except coccyx. Large vertebral arches. All have 3 foramina, 1 vertebral foramen and 2 transverse foramens. 2. Thoracic region, T1 up to T12. Larger and stronger than cervical vertebrae, have longer and larger transverse processes, distinguished by their vertebrocostal joints. Transverse processes articulate with the tubercles of the ribs except for T11 and T12. Bodies also have either facets or demi-facets for articulation with the heads of the ribs. 3. Lumbar region, L1 to L5. The largest and strongest of the unfused bones. Their various projections are short and thick, adapted for the attachment of large back muscles. 4. The sacrum, triangular and formed by 5 fused bones, S1 up to S5, begin to fuse between 16 and 18 years, completed by the age 13, a strong foundation for the pelvic girdle. Posterior portion of the pelvic cavity, medial to hip bones, is shorter, wider, and more curved between S2 and S3 in females. Sacral ala is formed by the fused transverse process of S1. 5. Coccyx is triangular in shape, formed by the fusion of 3 to 5 bones, fused later than the sacral vertebrae, 20 to 30 age. Articulates superiorly with the apex of the sacrum. Point is inferiorly in females. Point is anteriorly in males. Abnormal vertebral column. The diagram looks like this. The sternum, flat, vertically elongated bone, 15 cm, forms middle anterior part of thoracic cage. 3 parts: manubrium, body and xiphoid process, the sternal angle, the supraesternal notch, clavicular notch from the SC joints. The xiphoid process consists of hyaline cartilage, completely ossified at age 14. The ribs are curved, flat bones that form most of the thoracic cage. They are remarkably light in weight, yet highly resilient. 3 types of ribs: 1 true, 2 false, 3 floating. 1 true vertebrocostal ribs, 1 to 7 ribs, attached directly to the sternum through their own costal cartilage. 2 false vertebrocondylar ribs, 8 to 10 ribs, have cartilage that are joined to the rib just superior to them. 3 floating vertebral ribs, 11 to 12 ribs, have rudimentary cartilage that do not connect even indirectly with the sternum. Typical ribs, 3 to 9. Head has 2 facets separated by the crest of the head. 1 facet articulates with numerically corresponding vertebra. 1 facet, 2 vertebra superior to it. Neck connects head with body. Tubercle at the junction of the neck and the body. Costal angle, abrupt change in the curvature of the shaft. Body or shaft is thin, flat, and curved, most markedly at the angle where the rib turns anterolaterally. Typical ribs, first, second, and 12. First rib is the broadest. Its body is widest, shortest, and most sharply curved of the 7 true ribs. Has single facet. 2 ribs is thinner, less curved, and much longer than the first 1 rib. The first rib has 2 facets for articulation with T1 and T2 vertebrae. The 10 to 12 ribs, like the 1 rib, have only 1 facet on their heads. The 11 and 12 ribs are short and have no necks or tubercles. The appendicular skeletal pectoral girdle attach upper limbs to the axial skeleton, consists pairs of scapula and clavicle. The clavicle or collar bone, S-shaped, convex medial and concave lateral half. It connects the upper limb to the trunk, medial, enlarged and triangular. Articulates with the manubrium at sternoclavicular or SC joint. It transmits forces from the upper limb to the axial skeleton. Lateral end is flat and articulates with the acromion at the acromioclavicular or AC joint. Scapula or shoulder blade, a large triangular flat bone, lies on the posterolateral aspects of the thorax. 2 to 7 T ribs has 3 borders: medial, vertebral, lateral, axillary, and the superior border. Has 3 angles: superior, lateral, and inferior. Posterior surface is convex, divided into spinous, smaller, and infraspinous fossa, larger by spine of the scapula, anterior or costal surface, concave and forms subscapular fossa, acromion, lateral end of spine, flat, expanded part that articulate with the clavicle. Glenoid cavity or fossa, a shallow concave oval fossa, articulates with the head of humerus at the glenohumeral joint. It has supraglenoid and infraglenoid tubercles. Coracoid process is superior to the glenoid cavity, projects anterolaterally. Upper limb or extremity has 30 bones in 3 locations: the humerus in the arm, the ulna and the radius in the forearm, the 8 carpals in the carpus or wrist, the 5 metacarpals in the metacarpus or palm, the 14 phalanges bones of the digits. Humerus, longest and largest bone of the upper extremity, articulates proximally with the scapula and distally with ulna and radius. The proximal end features head, articulate with the glenoid cavity of the scapula, glenohumerus joint. Anatomical neck, distal to the head, greater tubercle, a lateral projection distal to the anatomical neck, lesser tubercle, which projects anteriorly, and intertubercular sulcus, a groove between the 2 tubercles. Surgical neck, a constriction distal to the tubercles, common site of fracture. Distal humerus features the capitulum, rounded knob on the lateral aspect, articulates with radius. The radial fossa, anterior depression above the capitulum, articulates with the head of the radius when the forearm is flexed. The trochlea, medial to the capitulum and articulate with the wrist. The coronoid fossa, anterior depression that receives the coronoid process of the ulna when the forearm is flexed. The olecranon fossa, large posterior depression that receives the olecranon of the ulna when the forearm is extended. The medial and lateral epicondyles, rough projections for muscle attachment. Ulna and radius. The ulna, located medially, longer than the radius, at proximal end of the ulna. Olecranon coronoid process articulates with trochlear notch, large curved area between the olecranon and the coronoid process. Radial notch, a depression lateral and inferior to the trochlear notch, articulate with the head of radius. Styloid process, located on the posterior side of distal ulna.